and welcome back to our Beyond Sugar platform, wherein that we discuss different aspects which are related to diabetes. And today we are going to talk about a very relevant topic, that is diabetes and obesity. What's the connection? Because I think in today's era, it has become very important with our lifestyle changes to talk about how obesity can lead to diabetes. So, to talk to us about this, we have Dr. Santosh, who is a consultant endocrinologist at Magna Centers for Obesity, Diabetes, and Endocrinology at Hyderabad. Welcome, Dr. Santosh.
Hi, how are you?
Thank you, sir. Sir, when we are talking about diabetes and obesity, first of all, it is very important to understand whom we will call as the patient is overweight or obese so that we can talk further.
Okay, so actually, there are different criteria for defining obesity. So, what we commonly use is the body mass index because body mass index is something that we can measure at home or we can measure in the doctor's clinic also. So, what is body mass index? It is the weight of a person in kilograms divided by height in meters square. So that's, for example, now suppose my weight is 100 kilograms and my height is 190 centimeters. It's 100 divided by 1.9 into 1.9. So that's what a BMI is. So when you get a BMI, you will get one particular number which is ranging between 18 to say 34, 35, like that. So what is a normal BMI? So normal BMI for different countries is different, and what has been described in India is a normal BMI is anything between 19 to 23. If your body mass index is between 23 to 25, you are classified as obese. And if, you're classified as overweight. And if your BMI is above 25, you are classified as obese in India, actually. So if you look at this particular criteria, the prevalence of overweight and obesity is very high. So we should try at all times to keep a BMI below 25. Let's keep it that way. Above 25 is something of concern, and we need to reach out to someone for treatment, or we should be ourselves doing something for reducing our weight and getting the BMI to below 25, if not below 23, which is the most ideal number for Indians. But
Thank you.
sometimes,
Yeah.
if you see, there are certain bodybuilders actually. They go and build a lot of muscle, so their BMI must be 27, 28, but they are not necessarily obese. So there is another criteria also that we are using nowadays. We are using the waist circumference. So waist circumference is like just like when you wear your pants actually. So somewhere between the lower part of the rib and the upper part of the hip bone, we take a tape and we measure the waist circumference. So a waist circumference of greater than 90 centimeters in males and greater than 80 centimeter in women is called as abdominally obese, which is more dangerous than just having a high BMI. So these are the two basic definitions that we use for defining whether a person is overweight or obese or having normal weight.
Thank you, sir. Thank you for highlighting. So, this session is for those people who are having BMI more than 25 or who have a high waist circumference. So, please measure your BMI first and then do concentrate on this session. So, sir, you highlighted who are the patients who are obese or overweight patients. So, now what is the link between the patients being overweight or obese and then this leads to diabetes?
So obesity is one of the leading factors for development of diabetes. So if you look at it from the genetic point of view, the same genes which lead to a person causing obesity will also cause type 2 diabetes in the genetic point of view. But if you look at a person who is having obesity, he or she will be having something called as insulin resistance. That means the more obese you are, especially the in the tummy area. So if you have a lot of weight which is concentrated in the tummy area, you start developing a condition called as insulin resistance because of the same. Now, what is insulin resistance? Insulin resistance is a condition where the body is producing insulin properly, but that insulin is not able to act properly. Now, for example, if the body requires, this is the normal sugar, and the body requires this much insulin to keep it normal, those people who have insulin resistance, this insulin is not working for them. So, insulin production will increase in obesity people. So, insulin production will increase. The sugar will remain more or less normal during the early stages of obesity. But after some time, what will happen is the pancreas, which is producing insulin from inside, it tends to get slowly exhausted. It gets tired. Then, when that happens, the insulin production in the body will slowly start coming down, and this will lead to a subsequent increase in the blood sugar. So, a failing beta cell of the pancreas in response to long standing weight is the number one reason for developing type 2 diabetes. So, that is very, very important. So insulin resistance is precipitated by not only presence of weight gain, it's also precipitated by the absence of a good diet, absence of regular exercise, taking a lot of stress. So all of them put together will ultimately lead to the most dreaded complication, that is in fact diabetes.
So you spoke about three things. First is insulin, which is an hormone. Second is you spoke about stress. That also we will talk about in some time. And third, which you talk about the diet. So first talk about hormones. So you said insulin hormone resistance can also lead to diabetes. So are there any other hormone which can lead to diabetes? Any hormonal factor?
So diabetes by definition itself is a condition where the insulin in the body is either not able to act properly to control your blood sugar, or the production of insulin is not sufficient in the body. So if insulin is not there right from the beginning, so suppose there are some unfortunate children where insulin is just not produced in their body, so they are told to have type 1 diabetes. But today we are talking more about obesity leading to diabetes. They usually have developed of type 2 diabetes where the insulin production is in fact high, but that insulin is not able to act properly, and therefore they develop diabetes. Now if you have to ask about other hormones that interplay to the leading of diabetes, there are something called as counter regulatory hormones. There are some hormones in the body which work against the insulin that is present in the body. So for example, thyroid hormone. So if somebody is having hyperthyroidism, they tend to develop diabetes earlier. Growth hormone, cortisol. Catecholamines. So what is catecholamines? Catecholamines is adrenaline. Basically, if you're anxious all the times, the body will produce a lot of stress hormones like adrenaline and cortisol, and this will act against the insulin that is produced in the body, which will lead to diabetes, basically.
So I guess, sir, you answered the second question as well, like how stress can induce diabetes. You definitely mentioned that stress can lead to increased amount of adrenaline and cortisol, which can lead to development of diabetes.
Correct.
So anything you would like to add on stress part? How
So
stress can again like lead to diabetes?
yeah, so mainly it's stress acts by increasing the catecholamines and the cortisol. So stress is becoming an important part of our day-to-day life. Almost people say that if they are not reaching an optimum level of stress, they are not working adequately. That's what the dictum of even work is. So those people who are constantly stressed about their work or constantly stressed about their studies, for example, they'll always have this high levels of catecholamines and other things, and it also leads to poor sleep quality. So if stress is high, sleep will be less. Lack of sleep will also worsen the counter regulatory hormones, which leads to diabetes. So management of stress is a very, very important aspect in both reducing the risk for diabetes and also obesity for that matter.
Thank you, sir. So the third and most important part when we are talking about obesity and diabetes, which you spoke, is diet. So when we are talking about diet, any person who is diabetic and is obese or overweight, what kind of role the diet plays in that particular patient's life?
So no, I'll start with a story over here. Okay, so let's see what were the Indians initially. So Indians, when genetically we are programmed in such a way that there is a very fertile period in the season, and then there was a famine period in the season. So our Indian genes, how they are made up is during the fertile phase when there is a lot of food available, we used to eat a lot of food, and that whatever food used to be available used to get stored during the famine phase, and therefore the food that was there in the fertile phase was used during the famine phase. So even an Indian person who used to eat a large amount of food used to be able to survive through the famine phase. But what has happened in the last 30 years, 40 years? Suddenly food has become available in abundance. So even right, food is available all over the place. There are so many restaurants, there are so many advertisements, there are so many fast foods. Nowadays, apps are there where you can just sit at home and order. So food, there is no famine period only. Our genes are made to absorb excess food when there is a fertile phase and there is a famine phase. It is supposed to be working. But now our genes are exposed to food continuously, basically. So, especially Indians, now that we are exposed to food 365 days in a year, we are at a much higher risk for developing obesity than the other counterparts who don't have this, harvest phase followed by famine phase, harvest phase followed by famine phase. So, our genes are made in such a way that we absorb everything that we eat very fast, so much faster. So, diet is the number one reason, poor diet is the number one reason why Indians are at a higher risk for developing obesity and type 2 diabetes. So when you come for management of the same also, especially in obesity patient, we say that the number one, two, and three treatments for obesity management is in fact diet, and diet only. So if you are able to restrict your kilocalories, you will lose weight. That is the only way of losing weight, basically. So, for example, we in our clinics we use one calculation. So we take the ideal body weight as per the height of the patient. Now, for example, if a person is 170 centimeters in height, we talk about his ideal body weight being around 70 kilograms. So, if 70 kilograms is the ideal body weight, we multiply it by 20. So 70 into 20, 1400 kilocalories if a person is eating, the person will slowly start to reduce weight. So that is the most important part. If you are able to restrict more calories than that, you will lose weight faster actually. So that's the main thing. So calorie restriction is the most important part. So while you're restricting calories, people have started now devising different ways of doing the same. So some people say that why don't you remove carbohydrates from the diet and concentrate only on eating fats? But the keto diet, which people use, most people don't like it actually. They use it for around half month, 1 month, and then they stop using it. And still, the long-term effects of keto diets on, for example, your health as far as cholesterol is concerned, heart disease is concerned, kidney stones are concerned, nobody knows. So keto diet never gained popularity. Another very interesting diet which people like to follow to lose weight is the intermittent fasting. So intermittent fasting it's a good diet actually. So if you are eating for example 8 hours in a day and you're fasting for the remaining 16 hours in a day, then the insulin secretion in the body comes down, the pancreas takes some rest during the day, and the fat deposition generally increases. People lose weight with intermittent fasting also. But given our culture, most people don't like to do intermittent fasting as well. So what is the basic advice that you would give for a person who's trying to lose weight is, why don't you shift to a low calorie, small, frequent meal pattern with high fibers. So you take a lot of fibers. So you eat a lot of vegetables, you can eat a lot of fruits, but don't eat at any one time very large amount of food. So if you eat a very large amount of food, for example, you're eating rice, roti, dal, chawal, sabji, everything at one time, what is going to happen is the insulin secretion is going to increase at that particular time, which is leading to more and more weight gain during the tummy area. So why don't you eat small and frequent meals? That is the most simplest way of losing weight. Instead of going for the fancy diets, for example, intermittent fasting or for a keto diet, you can concentrate on a low calorie, high fiber diet and small and frequent meal, which will help the most in sustaining weight loss for a longer period of time.
I guess that's a very important tip, sir. That small, frequent diets which have high fibers and proteins. So I think if this is been managed by the obese or overweight patient, then they would be able to see some kind of effect on diabetes as well. So does this reduction in weight leads to some kind of improvement in blood glucose levels?
Yes. So initially, when we used to manage diabetes, we used to mainly concentrate only on the blood sugar level. So if the sugar is this much, we give this particular tablet, the sugar will get controlled. But nowadays, the entire dictum has changed. Over the last 4 to 5 years, we doctors have also started using weight as a very important parameter in the management of diabetes, because we know now percentage wise also, if you are able to control 5% of your body weight also, your cholesterol and your sugar is improving already. Now, if you are able to lose around 10% of your body weight, you will be able to prevent from moving to pre-diabetes to diabetic state. And if you lose around 15 to 20% of your body weight, you can also achieve something called as diabetes remission. Now, what is diabetes remission? Is once you are diagnosed with diabetes, the doctor puts you on some tablets, but after which you lose around 14 to 15% of your body weight, you might reach a stage where you might not require any medicines to keep your blood sugar under control. You can manage it with only diet and exercise. So weight loss is something that we really stress on in every person who comes with diabetes. So initially, probably around 4 or 5 years ago, we used to say, concentrate on your diet, concentrate on your exercise. But nowadays, our discussion is changing towards, why don't you lose 5% of your body weight? Why don't we target losing 10% of your body weight? Now, our entire communication with the patient is changing in terms of body weight, because it is documented without any doubt that if you lose 5% of your body weight, also your blood sugar will improve dramatically. If you lose 10 to 15% of your body weight, you might even undergo diabetes remission, where you might not require any medications for management of diabetes, but can manage it only with diet and exercise.
So it becomes very important for a person who is obese lose their weight so that you can control your diabetes. That's a very important part. But sir, when we are talking about diabetes, many of people may not have control to stop their cravings for the food. But in that case, people may opt for bariatric surgery. So when we are talking about a person who is undergoing bariatric surgery, will this also help the person to control diabetes?
Yes. So bariatric surgery, there are certain guidelines. So if the body weight is above a certain BMI, plus there are complications associated with that. So a BMI of about 33 with presence of diabetes, or there is presence of hypertension or presence of heart disease. If a person undergoes a bariatric surgery and loses weight, just as I said before, bariatric surgery will help in dramatic reduction of body weight. So most patients who undergo bariatric surgery are able to easily lose up to 15 to 20% of their body weight. So if you lose 15 to 20% of your body weight, there is an equivalent improvement in the blood sugar. A person who is having a lot of diabetes medicines might go to a stage where he or she might be requiring minimum medicines or no medicines. There is dramatic improvement in the blood pressure and cholesterol, and also other complications of obesity. So bariatric surgery is one of the very good ways of treating obesity, basically, which will help in improving the blood sugar as well.
That's very important that there is another way also for the obese people to control their weight and control their diabetes in that way. So when we
Correct.
are talking about diabetes and obesity, I think there is a two-way connection, like how obesity can lead to diabetes. Maybe similar way, diabetes can also make people obese or make it harder to lose weight. So is that true?
Yes. So presence of diabetes, unfortunately, it makes a person to the more difficult to lose weight, because diabetes is a condition where the hormonal milieu of the body is completely changed. There are certain hormonal changes. For example, the anti-insulin hormones are continuously high in those sort of people. They are not able to lose weight because of that. Second is, there are certain medicines in diabetes which can cause a little bit of low sugar, and the person tends to snack intermittently so that he or she will not develop hypoglycemia or low blood sugar, and therefore the tendency for overeating in diabetes increases. And also, many people with diabetes, they are very upset so with their condition. So a person who is very sad or depressed is not able to eat, will end up eating more because of the sadness or depression. And lastly, but not last the least, is the people who develop diabetes complications, for example, diabetic nerve disease, or they develop certain problems with their balance, or they develop joint problems because of diabetes. They are not able to exercise as much as people without diabetes can do. So therefore, losing weight with diabetes becomes much more difficult, because of the hormonal conditions, because of the medications that are being used for diabetes, and also because of the complications such as depression, or the nerve related and muscle related problems.
So maybe the last question, and you have highlighted some bit of it. So when we are talking about diabetes and obesity, what kind of complications the patient may have if it is not controlled?
So the complications of diabetes per se. So what are the main complications of diabetes? Number one is diabetic nerve disease, diabetic kidney disease, and diabetic eye disease. They all get precipitated because of the presence of obesity. But the one complication that gets accelerated the maximum because of the presence of obesity in diabetes is heart disease. So obesity itself is a risk factor for developing heart disease. Obesity is itself a reason for developing higher blood pressure, higher blood cholesterol levels, which worsen the risk of heart disease. And diabetes itself is present, which is causing heart disease. So heart disease seems to be the number one reason where people with diabetes. So nowadays we are using this word called as diabetes, where a person is having diabetes and obesity together. Heart disease becomes the number one complications for developing diabetes. So by reducing weight, we are not only reducing the blood glucose and the complications on the eyes, we are significantly reducing the impact on heart disease. So nowadays, for the management of diabetes, we have two other agents which we are now using. So one of them is known as the SGLT2 inhibitors. So SGLT2 inhibitors are a group of drugs which not only help in good blood glucose control, they help the patient in reducing the body weight also, and they also directly affect in protecting the heart in some way and also protect the kidney in another way. There is also another group of drugs which has created a lot of hype on social media. That is the GLP-1 receptor agonist. So people talk about Ribelsis, Ozempic, Mounjaro. Many people, if you go on to Facebook and Instagram nowadays, many people are talking about these drugs. So these drugs are prescription drugs. Please don't use them yourself. So, but these drugs are also very useful in helping in controlling the blood sugar and also causing a very good weight reduction, and which has indirect and direct effects on protecting the heart and the kidney. So people with diabetes and obesity, they should not lose heart basically, because there are certain treatments which are now available in the armamentarium in the management of diabetes, which not only control their blood sugar, they also help in losing body weight and protecting the heart and kidneys directly.
Thank you, sir. It was a very enlightening session. What you talk about diabetes and obesity and its associated complications, which it can lead to. So, any last comment for our audience, sir?
So, in the pillars of diabetes management, initially we doctors also used to concentrate on good blood sugar control, good blood pressure control, and good cholesterol control is what we used to think were the pillars of management of diabetes. But nowadays, the fourth pillar has been added, which is very strong, is to target a certain percentage of weight loss. Minimum, you should target 5% of weight loss if you're overweight or obese. If not 10 to 15%. So if you are able to lose 15% of your body weight, then there is dramatic reduction in the sugar, BP, cholesterol, everything. So the whatever diet we are using, whatever exercise we are using, whatever de-stressing mechanisms we are using, whatever medications we are using, should be able to tackle all this. It should be able to control the blood glucose, the blood pressure, the blood cholesterol profile, and also help directly or indirectly in reducing weight, at least to the tune of 5 to 10%.
Thank you, sir. It was a very informative session, and I guess definitely our audience going to benefit from this session. Thank you once again for joining us here today, and
Sure.
thanks to our audience as well to join us.